So that many women around the world will have dilated veins within their pelvis. Doesn't necessarily mean that they get the symptoms. And when patients do get the symptoms, then that means that they have pelvic venous congestion. What I mean by symptoms is patients have at least 6 months of chronic pelvic pain, and that pain can be ranging from mild to being very severe, meaning that patients can't pick up their children or have to even take opioids. It severely affects, and some women, it can severely affect their quality of life. That they also have other symptoms that can range from feeling the pain going on the left side or the right side. It can go into their back, it can go down their legs. They can also have pain during sex, and also very, very painful periods. And some women, it can even affect their bladder and their bowel functions as well. So there's a whole range of symptoms that patients can experience. And I see women, every single woman that I've treated has got a different variation of those symptoms. In regards to treatment options, there aren't many. For surgery, potentially ligating the ovarian vein is a treatment option, but that hasn't got success rates half as good as pelvic venous embolization, which as a day case procedure has the ability to transform patients' lives with this condition. And it's an absolute real game changer for women with this condition and chronic pelvic pain. So I perform this procedure under local anesthetic with some sedation as well to make the procedure as comfortable as the patient as comfortable as they can, and give them a nice patient experience as well. I perform the procedure via a small neck puncture into the vein in the neck. And then through that, I then use X-rays to guide a catheter, which is a small tube, down into the veins that are causing the problem within the pelvis, which are the dilated veins. And then I block those veins with some sclerosant and also some small metal coils. The procedure itself takes normally about 30 minutes, sometimes up to an hour if it's a bit more complex. And it's normally very well tolerated. Sometimes the patients actually can get some pelvic discomfort during the procedure when we use the sclerosant foam. And I actually find that's actually a really good delineator that the procedure should work. So if it actually mimics their symptoms whilst they're on the table, it normally means that the patient will have a good response. Some women don't get pain when you do the procedure. Everyone's a little bit different, but I find that the patients who do get a little bit of discomfort on the table when we're doing the procedure are the ones that actually normally get a good symptomatic response from it. Following the procedure, if they have had some discomfort, normally by the time we finish, that's eased off. The patient is then taken to a recovery where we give them some more painkillers if they do have any pain, and they're discharged a few hours later once the sedation has worn off. Most patients don't have much in the way of discomfort when they're discharged, but we give them some painkillers anyway should they get any. There are some small risks involved. I think that the data would suggest that they're in the region of 2 to 3%. In my experience, I haven't had any major risks at all in my practice, or any complications. But the complications that you would name to patients would be some small risks of bleeding or bruising because you are puncturing a vein in the neck, risks of infection, risks of and the main risk that patients get concerned about is the metal coils that we place within the vein. They can potentially migrate or move, whether that be into the kidney vein or to the heart or lungs. What I do to normally try and prevent that is to say to patients to not do strenuous exercise for at least a week, just to let the coils set in place. In my practice, I haven't had a coil migration, but I have heard of it happening. And that's the one risk that patients do get a little bit concerned about. The other thing to mention is you can get some thrombophlebitis, which can give patients some pain afterwards, which is why we give patients the painkillers. And there is a risk that the symptoms or the venous congestion symptoms can come back, or recurrence as we call it, and that is the potential risk as a late complication. The majority of patients recover very quickly from this procedure, but everyone is different. Every single patient I treat is different. Some patients do get some discomfort the next day, and in rare circumstances, that discomfort can be quite severe, needing to need painkillers. But the vast majority of patients that I treat with this condition recover very quickly. I normally say to patients to plan for at least a week to 2 weeks, but I think that's in some ways a bit too much. But everyone, as I said, some women just take a little bit longer than others. In regards to the procedure and how it works, some women will notice instantly that their pains are better. They'll tell me that as soon as I finish, that they feel better and the pain's improved. Some women will just take that little bit longer. I have had women that it's taken a couple of months. They've just woken up in the morning and suddenly the pain's disappeared. So everyone's different, and everyone's different in their recovery, and everyone's different in their response. But the vast majority, I would say, would tolerate the procedure very well with minimal symptoms, if any. And the vast majority, if it is to work, will notice it works very, very quickly. I would have to say that in all my patients, I have to be realistic. The procedure, even in the most ideal patient with dilated veins on their imaging, as well as classical symptoms, the procedure only is successful in about 80%. So whilst you want to promise that it's going to work, I think you have to say to patients, and realistically, you can't make full promises that it's going to be definitely, it's not 100%. Okay. But I think at 80%, I think it's a really amazing chance of transforming a patient's life with what is a minimally invasive procedure with no general anesthetic, and also very, very low complication rates. So in regards to the risks versus benefits, the benefits significantly outweigh the potential risks, in my opinion.